my very great pleasure to celebrate NAIDOC Week with you on behalf of the Council of Deans of Nursing and Midwifery of Australia and New Zealand, or the CDNM. The CDNM is the peak organisation that represents the deans and heads of the schools of nursing and midwifery in universities that offer undergraduate and postgraduate programs in nursing and midwifery throughout Australia and New Zealand. My name is Gina Kruger, and I am a member of the CDNM Midwifery Advisory Group, and I'm the Associate Professor of Midwifery and Deputy Head of Nursing and Midwifery Programs at Victoria University in Melbourne. I begin today by acknowledging the traditional owners and custodians of country, Australia's first people throughout Australia, and their unbroken connection to country, land, waters and community. I pay my respects to them, their cultures, and particularly this NAIDOC Week, their elders past, present and emerging. I extend that respect to Aboriginal and Torres Strait Islander peoples present. I come to you today from the traditional lands of the Wurundjeri people. National NAIDOC Week celebrations are held across Australia in the first week of July each year, Sunday to Sunday, to celebrate and recognise the rich history, culture and achievements of Aboriginal and Torres Strait Islander peoples. NAIDOC Week is an opportunity for all Australians to learn about our First Nations cultures and histories and participate in the celebrations of the oldest continuous living cultures on Earth. You can support and get to know your local Aboriginal and or Torres Strait Islander communities through activities and events held across the country. It is now my great pleasure to introduce our guest speakers, Professor Donna Hartz, who I will be interviewing today. Professor Donna Hartz is the Clinical Chair in Midwifery and just commenced a new position a few days ago, July this year. Donna is a midwife and nurse with over 40 years' experience as a clinician, educator, lecturer, manager, consultant and researcher. She identifies as a descendant of the Kamilaroi or Gomeroi people. She's a newly appointed Professor of Midwifery at Western Sydney University and the inaugural Chair of Midwifery for Western Sydney Local Health District. She holds adjunct positions at Charles Darwin University and the University of Newcastle and is a Fellow of the Australian College of Midwives. Donna has extensive experience in maternity care and service redesign, in particular caseload midwifery models of care and maternity service clinical governance. Donna's current major research projects include birthing on country projects, Aboriginal breastfeeding support, child protection education and smoking cessation in pregnancy. So I'm wondering, first of all, Donna, there is a discordance in the retention rate regarding the retention of First Nation nurses and midwives, both as students and as staff. Can you elaborate on strategies to retain First Nation nurses and midwives?
Thank you, Gina, for that wonderful introduction, and being NAIDOC Week, and as always, just acknowledging the traditional owners of the countries that you will all be gathering on today and paying respect to elders past, present and emerging. I'm here on beautiful Darug country in the western suburbs of Sydney. I live on Darkinjung country on the Central Coast, and my ancestors are Kamilaroi, as you mentioned, which is up in north west New South Wales. Yamamalia, hello friends. That's the small amount of Kamilaroi that I do know from our language, which is certainly being revived in more modern times. So you want to know about retention, recruitment and retention of First Nations and nurses and midwives. Well, being a member of CATSINM, there's a fabulous report just recently been released, the second of its kind, Genki, which is the Getting Them and Keeping Them report. And what we know, the essence of that is that we can certainly recruit Aboriginal and Torres Strait Islander people into nursing and midwifery programs, but it's the keeping them that seems to be the issue. We know from the early work of Professor Royanne West, I know who's quite a strong friend and ally of the council, that she, her early work approximated about 36% completion rate for First Nations people compared to 60%. Now, I know in the most recent Universities Australia report that we're verging up to a bit over 40% now, but still far more discordant from non-Indigenous completions within their degrees. Now, what we are finding emerging from some of our literature, I've been supervising a beautiful Aboriginal Darug woman, Renee Coleman, here in Sydney, and she did as part of her honours, has done a scoping integrated literature review, looking at why the issues and the barriers, the enhancers and the barriers for First Nations Bachelor of Midwifery students. And we know one of the core issues of it is a lack of cultural safety. Now, I know many of us don't go to work to not make people feel comfortable. In fact, we're in the caring profession and we want to be trying to keep our populations and our staff and our emerging clinicians and leaders safe. But I always use this opportunity for us to really start to check in with ourselves about what are we doing in our environments around enabling somebody to feel as safe as they can on their cultural ground. So that seems to be the number one issue around retention of our midwives, and that would be, I would presume, the same for nursing. Something else that seems to be really important is that our Aboriginal students, Aboriginal and Torres Strait Islander students, have an opportunity to work within their own communities or work within areas where there are other Aboriginal people. Sometimes it can feel, if you think about our culture, it's very much a kinship system, and when they're not feeling that they're connecting, that they can feel very frightened, very dissociated and not safe. I think that we are doing some, in terms of academia and clinical interface, we are doing some good things around mentoring. And I know Katzen in particular is doing a lot of work around mentoring. So I think, there could be some good strategies in trying to find that community familial type environment to support our students to remain safe and focused. For our students too, often I know in midwifery in particular, we have a really high ATAR in many of our courses for a bachelor program. So it's quite many of our people don't feel that that's attainable for them to get in. So I think, how can we improve it? I think start looking at your enabling programs and how we can create better pathways into our bachelor programs where they're enabled, that they're not feeling that they're out of their depth, they're not feeling othered or different. So I think, you've got some really fabulous university enabling programs and units that have been very beneficial to many students to enable them to feel that sense of community. I think the big one too is, as I go back to where we all go to work to do our best job there and to be inclusive, but unless we continue to check in on ourselves about our unconscious biases around different ethnicities, in particular for Aboriginal and Torres Strait Islander students and peoples, and the way we talk and the dialogue we use and making sure our language is inclusive, that we're not going to create that, we're not going to get rid of that inequity. And I think from as deans of nursing and midwifery schools in Australia, by incorporating cultural immersion and cultural competency or cultural enabling programs as a mandatory component, and not just as, we see many of them as a tick box, you do it online, but actually engaging your local communities to come in and help you to shift that consciousness. And I think, without going too much into our current national politics, it's probably a very good time to be thinking around those terms.
Thanks, Donna. Those comments, integrated cultural awareness and learning, into all our undergraduate, postgraduate programs, and also the connectedness and kinship of Aboriginal and Torres Strait Islander peoples and their needs for effective healthcare and maternity care. So thank you for that.
I think that there's also good opportunities. I've just come from Yarramundi. I'm here at West Sydney University today, so a shout out to all of Deb Hatch and her team here at Western Sydney University and the beautiful welcome I've had over the last few days. So in the theme of NAIDOC this week, it's about our elders, and that we had 6 elders on stage that were sharing their wisdoms. And I think it was a really wonderful way. We had a really good turnout actually for most of the university staff. I was a bit surprised because some of these NAIDOC functions or reconciliation functions aren't often that well patronaged, and I just was really impressed that people are interested in listening, and the wisdom from our elders, right from culture to considering our youth and what's important. And for us, for many of our students, they are young, considering what's important for them to learn and making them feel safe, right to considering truth telling and listening to what the history is. So I think there's a lot we can learn from the elders. So in terms of being deans in faculties, engaging local elders, especially if it's women's business, bringing in women elders, for those that perhaps have got health background or from the local medical centres or land councils or cultural groups, to engage with the staff and engage with the students. And then I'll shout out to Sydney University. You do a fabulous job in bringing in the elders and having fabulous cultural immersion days during orientation week.
My final question is, how are you celebrating NAIDOC week this year?
I live on Darkinjung country on the Central Coast, so we've had lots of events locally, which has been beautiful to see culture brought to the seaside. And especially at the moment at Tharawal, our beautiful whales, which are a totem of the Darkinjung people, on their highway. So it's been wonderful celebrating NAIDOC week with that. And today I've been fortunate enough to be at the Yarramundi lecture, as I mentioned, which was a beautiful display and embracing of elders on Darug and attached nations around Darug, and bringing their wisdom to the university community. So that was, and students, there was one of our young Aboriginal students up there. He was just beautiful. So he was talking about how the elders had touched him. So that's how I'm celebrating NAIDOC week.
Fabulous. That sounds very inspiring, especially with the meeting of the younger and elder generations. This is how we learn, inform knowledge, work together. So that's great. Thank you, Donna.
Thank you, Gina.
So I'd like to give great thanks for sharing such wonderful, meaningful insight related to midwifery, related to elders, the process. And I'd just like to wish everybody a celebratory NAIDOC week. Thank you.